subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are here on April 2nd, 2022. It's a festive day, so greetings to all of you. And we are delighted to have here with us Dr. Rahul Pandit. Dr. Rahul Pandit, as we know, is Director of Critical Care Medicine and ICU at Fortis in Mumbai, and the member of the COVID Taskforce, which is of the Government of India and the Government of Maharashtra. And today he is going to speak with us on diagnosis and control of non-communicable diseases for senior citizens. A little about Dr. Pandit. Dr. Pandit is a senior intensive care consultant with over 2 decades of experience and is Director of Critical Care Medicine and ICU at the Fortis Mumbai, having a prestigious fellowship of Joint Faculty of Intensive Care Medicine in Australia, where he was mentioning to us where he's practiced for a fair bit. Dr. Pandit plays the lead role in setting up ICU policies, protocols, and patient care algorithms. He has also completed the European Diploma in Intensive Care Medicine. As I mentioned, he is the member of the Maharashtra government as well as the National Task Force on COVID-19. And as we all know, this task force has played a key role, and I might even add over here, an excellent role in patient management control for serious and critical ill patients. It also recommends the requirement of specialist doctors and healthcare support staff in the critical care hospitals, suitable drug protocol to maintain uniformity in treating critically ill patients, and recommends criteria and logistic requirements to transfer critical patients. He is also a member of the Fortis Medical Council. As we know, Fortis is a large health facility network in the country. He has had numerous publications and book chapters to his credit, along with guest lectures in several national and international conferences. His areas of interest include critical care, echocardiography, trauma, neurotrauma, obstetric emergencies in ICU, and proteomics and sepsis. Welcome to Health Live at Seniors Today, Dr. Pandit.
Thank you very much, Pradhimanji. It's a pleasure and delight. And first of all, a happy Gudi Padwa, Cheti Chand, Baisakhi, and a new year to everyone across the country and globe who are listening to your program. It's a pleasure and honor to be here, sir.
Thank you very much. And first of all, a salute to the task force which has been there. You all have done some fantastic work. And as we know, we are the government of Maharashtra, at least, which has, I must say, been exceedingly stringent about the protocol that it has followed, the various rules and regulations that have been there. And now it has eased things to the extent that, should I be saying goodbye to the mask?
No, you certainly should not be saying goodbye to the mask. If you read the advisory, unfortunately, the press has not done it in the right spirit. At times, they have sort of said mask mukti or get rid of mask. What the government has said is that it has not made it compulsory. So it's voluntary on our part now to understand that if the Disaster Management Act has been removed by the Government of India, all of these mandatory things which were done under that act. If that act is not applicable in the country anymore, the government has now moved towards voluntary precautions. For 2 years, we have been telling people, speaking with people, talking to them on webinars, with one-to-one conversations on television and stuff. Everybody now knows the importance of masking. I must again repeat, to the benefit of the crowd who is listening here right now, we as ICU specialists have been wearing this mask and entering COVID positive areas in the COVID positive ICUs where the viral loads have been huge. And it has been the mask which has been the most protective equipment for all of us. So there is no doubt that mask actually helps you to protect yourself. So in our own interest, in our own health interest, I think we should continue wearing a mask until the COVID-19 disease burden goes down considerably across the globe, because that's when you could really say that the mask is not necessary now. So now it's actually on our shoulders, the responsibility is on our shoulders to wear it.
So, let me ask you a very important question, which I'm sure a whole lot of people are have it in their minds. Now, over a period of time, when we're stepping out, suddenly now you have in housing complexes and wherever people are saying, "Arey, why the hell are you wearing a mask?" You know, and you also have domestic help coming home. You have people coming home, and they are being increasingly advised by various people that a mask is not important to wear. So, what from what you tell me, it is advisable that whenever you are outside, like it was in the past, keep wearing a mask.
So I would sort of go a bit more scientific in there. So where is it definitely advisable? It is advisable in closed and confined spaces where there is crowd. So if you have domestic help coming in your house, it is I mean, all of us live in 2-bedroom, 3-bedroom houses. We don't have palatial houses for us. So it is advisable that all the members of the house and the maid also wears a mask at that time so that we protect each other. We just don't know who would be positive. So if you're going in working in office space, which is got a closed confined space, it's advisable to wear a mask. If you're going to a closed confined space for a conference or wedding or so, it's advisable to wear a mask. It's very difficult. I know that people would. The next question I get all the time is that what about when we have food? What about when we have social lunches and dinners? I know it's difficult if you're vaccinated, and if you can still avoid having those dinners and parties, it is better. But if you're not, if you have to go, then I would say that keep it to the exposure, keep the exposure to the minimum. The maximum exposure happens when you're eating and drinking outside with people. That's the time when you're likely to be infected the most. When you're out of the house in the open and you have free flowing air and the breeze and air circulation is there, probably it is the safest to remove the mask at that time. Even then, I would say you keep it on, but it's a wrong perception. People actually wear a mask when it's breezy and good outside, and as soon as they enter the closed space, they actually remove the mask. It's the opposite way. When it's breezy and airy, you probably have a very less chance of getting infected. But when you're in a closed confined space, you have a very high chance of getting infected. But the disease burden in Mumbai, at least, is thankfully very low. In the country, the metropolitan cities also, the disease burden is low. In the rural areas, there is almost no disease burden right now. So I think the next few weeks, at least, we are in a happy space, and we should continue to do that.
Absolutely, Doctor. And so, can I request you to say a few words about the topic that we have, which is on
Yes.
non-communicable diseases. And those of you who have questions, and we've received quite a few questions. We've received also some requests of people that they're not able to come today because of the festival, etc. So if you could make your opening remarks, and those of you who have questions, please put them in the Q&A tab as always, and mention your gender and your age so that doctor could give you a considered reply. Over to you, doctor.
Sure. So I chose actually to speak on non-communicable diseases and its control. The reason being, if you just reflect back on the last 2 years, the people who had the worst outcome, unfortunately, were the ones who had comorbidities. And the non-communicable diseases don't reflect anything else, but they reflect our comorbidities. So the common non-communicable diseases which we face day to day in our life and see patients as doctors are blood pressure, diabetes, heart disease, kidney disease, liver disease. These are the diseases which unfortunately form a quantum of our population right now, especially blood pressure and high blood pressure and diabetes. And those patients in whom this was not controlled, or even unfortunately was only diagnosed when they had COVID-19 and then they got admitted to the hospital, they seem to have a very, very tough time recovering from the disease process. What we have also very clearly established that those people with these non-communicable diseases had a good control of their non-communicable diseases. Their risk of deteriorating from an infection was almost the same as general population which was healthy. So if you have a good controlled non-communicable disease, your risk comes down considerably from any other infectious disease which may have. And I'm not talking just about COVID-19. There is a year-round list of infections which we as Indians get exposed. because we live in a tropical country. So we have dengue, malaria, leptospirosis coming across in the months of monsoon, which should follow very soon. Then just before the winter, we have the usual influenza and the pneumonia season. We have tuberculosis. We are a very high tuberculosis burden country. And obviously diabetics and patients who have immunosuppressive therapies are at a high risk of actually catching up tuberculosis unknowingly. And unfortunately in them, there is also a high risk of patients who may get drug-resistant tuberculosis. So I think non-communicable diseases now are going to form the cornerstone of our patient care management and preventive medicine. If you remember, around 5 months ago, 6 months ago, it was, I think, just around the second wave, when we had the months of August, September, the Maza Kutumba Maji Zawabdari, or My Family, My Responsibility program was, launched by the Maharashtra government. And they actually did a door-to-door survey of all the 12 crore people who stay in the state. And one of the primary data which was collected in this was the comorbidities. And now we have a list of people who are diabetics, who are comorbids, who are having blood pressure in the state. And so does the entire country now. They have the similar program was launched in the northern states, especially Uttar Pradesh, was called as Ghar Ghar Dastak. So the government is actually putting a lot of effort now to identify what is the risk of population which we have currently, who is sort of carrying this burden of non-communicable diseases. And that population is a vulnerable population. One of the other landmark changes which we actually did in the pandemic, and I feel that was one of the big game changers, was we had a whole lot of people who unfortunately had a very severe disease burden in the start of the pandemic. And we were all caught off guard as doctors. When the task force came into existence, we actually had a program which we went through, and I think that's been one of the most successful programs, and that successful program was launched in Dharavi. What we did was we sent our pulse polio volunteers, and they went from house to house in Dharavi and found out which patients, people were staying there were carrying any disease burden of non-communicable diseases. And we did a quick checkup of those people, and we had a saturation probe put on them. Anybody who had a saturation of less than 92% was immediately brought to the hospital. And I think we saved significant number of lives, because those people who came to the hospital along with those pulse polio workers, most of them had a good outcome and they went back home safe. So I think the identification of non-communicable diseases is a big concern. Now, those of us who live in metro cities and who have access to healthcare, I was just mentioning it to you, Pradyumanji, that as soon as we turn 40 or 50, if you are working in a corporate kind of a job, you would be asked to go and undergo a health checkup. Now, why was this filter put in? This filter was put in to identify these non-communicable diseases. The corporate world understood it quickly. Now, those programs started to be called as executive health checkups, as if it was meant only for executives to have it. It was not for executives. It is actually for the whole population. Slowly, of course, it expanded to the elderly population, to the senior population as well. And now we have got a whole list of things which can be made quickly available at a day's request if you visit a hospital and undergo one of these checks. My thought process on that has been, as I mentioned before, is different. I would rather visit a doctor first and find out what test I should do. Of course, there would be some mandatory test which every doctor would nevertheless ask you once you cross a particular age limit. But I think a focused attention on these non-communicable diseases is important. And that's where I would like to sort of focus my today's question and answers and talks. There are a lot of programs which are now been launched by the government and even by the private corporate healths and in general by the Indian Medical Association also, that we should be looking at controlling our diabetic patients better, our hypertensive patients better. We should be addressing obesity as a problem in the country. These were some of the 3 top problems which we have identified. Because if we can control these three problems, you would not lead to heart disease, renal disease, liver disease, which are the consequences of these three primary problems. So I think our focus should be to control blood pressure, diabetes, and obesity. So eat well, walk every day, keep a control on your sugar. If you're detected as a diabetic or a hypertensive, strictly follow a medical advice so that your parameters are under control and they are not off the chart. Because God forbid, if you get an infectious disease in this uncontrolled comorbidity, the outcome unfortunately is far worse than what you would have if you would had no comorbidity, or you would have had a controlled comorbidity.
Thank you very much, Doctor. I think you've been very clear about your message about the need to take care of your sugar levels, your obesity, and your heart health, and of course hypertension. Doctor, we have a person who sent a message listening to your thing. Doctor, you mentioned I live in Mumbai, and I haven't. You mentioned about the survey being done, but nobody came to my home to do the survey. Is it? Did they ask the people from the building, or is it? Was it only in certain areas?
No, it was across the state. And if they would have missed out, I am sorry if they have missed out. I mean, of course, it was not something which was under our control as Taskforce, but it was the government of Maharashtra, the initiative. It was not done once, it was done twice. And the reason it was done twice was to actually pick up people who have missed out. So I have got four uncles, real uncles, who live in Mumbai. All of us had people visit their home twice. The second time off, it was, of course, just an inquiry that we've been here before. Are you the same people? And it was just, okay, thank you. And they went away. But a lot of people had people visit, unless the societies did not allow them to go, because these people were, they were school, they were pulse polio workers, they were government health workers, some of them were municipal workers. So I don't know the specifics of that, but certainly the mandate was to go to every house and pick up the information.
Doctor, I have to stray from the topic that we have, because there are at least 6 questions that have come which are about about the vaccination.
Sure.
So there's one question from Dr. Sakhara Medikar, who says he's taken 2 Covishield doses in the past 9 months, but on 4th Jan he had COVID. So can he go for the booster?
After 4th of April, he can go for the booster. It's 3 months recommendation. So he should take the additional dose if he's above 60 years of age, which is, I believe, he must be. So he can take his dose after 4th of April.
Doctor, I'm going to cheat and ask you this question. Tell me, what about people who are not 60, who are above 50 or 45 and who are not 60? When is the booster going to come for them?
It's going to come. If you read today's Times of India, the headline from the ICMR is that every adult in the country will need an additional dose or a booster dose. Obviously, the NTAGI, which is the National Task Force on Vaccine, is looking closely at that data. And we had a huge amount of disease burden again in the month of January, where a lot of people became positive. Some of them tested themselves, some of them chose not to test themselves. So I think we will probably see the booster for the additional dose rollout for rest of the population, the adult population, very soon.
And tell me, if I do find, for instance, I'm speaking about myself, if I do find that I'm able to get a booster dose from somewhere, is it a good idea to do it, or shall I wait for the official?
Wait for the official one, because very soon the additional dose or the booster dose will become mandatory for travel as well. And if you've taken an additional dose without the COVID app, you will not have the certificate, unless you again then manage to get certificate from somewhere. But then that's not what I can talk in a public forum. And
no, it's complicated. I appreciate that.
And I don't think the COVID does even allow you to have a certificate out of the blue. So the COVID app is pretty watertight. You can't do anything with that. And that's how it should be.
Oh, and absolutely. And I think it's important. I must tell you about my own case. I was, a friend of mine did say that, you can come and take the thing. But I said, no, it should go to the right people first. And then, one should. So there is another question that has come in. I've had 2 Covishield doses. The third, the booster also is Covishield, but shouldn't I be taking my next dose as the Covaxin or any other?
So this question is about mix and match vaccines. Now, the international data and the national data which is there is currently quite convincing for mRNA vaccine and Covishield, or what we call as Oxford vaccine outside. Okay. But we don't have a good convincing data right now for Covishield and Covaxin as a mix and match. The studies are going on, and as soon as the data comes in, based on the results of the study, the recommendations would be made whether we should do a mix and match. Mix and match makes a lot of sense, but only when we have scientific data to prove that you can mix and match this group of vaccine, not just like that.
And doctor, there is somebody who said my grandchild has just got a vaccine, and is the safety level for given the fact that there were some old vaccines also that were found, are the safety levels all right? I hope I have asked the right question that you want to say, but it's about the safety levels of the question of the vaccinations, given the fact that there was some news about expired vaccinations that were available.
I think nobody would give an expired vaccine. The news where the vaccination expiry date was pushed ahead, it was done by the government. If it was done by the government, trust me, we have got to trust our own government. Nobody will actually give you expired doses. So I don't think we should think about these things. These things are pretty standard. Just like you would go to a medical store and look at the expiry date and take a vaccine or take a tablet or an injection. Exactly in the same way, the hospitals are mandated to look after the cold chain, the vaccination dates, the expiry dates, the production date, the batch number, and the batch number and everything reflects on your COVID certificate. So it's not something that can be taken up lightly. The government has got very stringent rules for that, and they take this very seriously. So rest assured, it's a safe vaccine for you.
And one last question that is there on the vaccination is about the new forms of vaccination that have come in, and the oral vaccine that is there. Is that something that one must
nasal vaccine,
right?
Yeah. So the generation 2 vaccines will be out very soon. The vaccine companies are trying very hard to have better and better vaccines. The first generation of vaccines gave us protection from the disease, the severe disease, beg your pardon. We are ultimately wanting to produce a vaccine which will give us immunity from the disease itself. So just like we have polio and we could eradicate polio, we should be able to have vaccines which will keep on improving in their efficacy and will be able to bring down the disease burden. But remember, this is a RNA-based vaccine. That is an RNA-based virus. Influenza is an RNA virus, and for last 200 years that we know, influenza has been around, and we have a vaccine for influenza almost for last 50 odd years, which people keep on taking every winter. We've not been able to eradicate influenza out of our system. So I think COVID would also pose a similar sort of a challenge, but at least the disease burden would come down, the severity of disease would come down, and it would probably just remain like a common cold or cough, and hopefully not cause this kind of infectivity around. That is what we are wanting. So the nasal oral vaccine is the one step towards providing that kind of a immune system or an immune barrier in our mucosa, because where do we get this from? It comes to us from our nose or the mouth. So if our nasal or the oral mucosa is protected, you would have a significant amount of protection from the disease.
But doctor, this nasal vaccine that will come, when it comes, when can that be administered? If you've already had a booster, then is it still necessary for you to
I think it will be an additional dose again, which would be offered. So let the trials get over. Once the trials are over and it's available, it will be probably given another additional dose, because it is a mucosal immunity which we are looking at, not cellular immunity which the other vaccines are offering you.
Right. Yeah, I think that's an important thing which is there, that about. But are these going to be given as per just as the vaccine is there, you need to take go to the COVID app and then do it? Is that something that is
no idea? We don't have any. So yeah, it will be through the COVID app. I can assure you that anything to do with COVID will be through COVID app. But we just don't know the process because they are not yet out for approval. So unless they are approved and the way they would like to be then distributed and administered is a two different processes. So first thing is to scientifically approve them that they are safe and they are okay to be given. Then when to administer them, how to administer them, what is the process? That's a different process altogether.
Right. Doctor, there's a question that has come in that in the last phase of COVID, I bought several rapid antigen test packets. Should I now return them to the chemist, or should I still keep them? Is there an expiry level that these
every kit would have an expiry level because they are artificially packed and stored. So if you have several of them lying around and if you can return them back, you please return them back, because it's unlikely that India as a country would run out of antigen test kits. There were some countries in the peak of COVID, for example, again Australia, I know there was a huge shortage. In fact, they had rationed it out to if one person can buy only one because people were stocking it up. I don't think we will be having that kind of a problem. We have got a good production. We are Atmanirbhar Bharat. We have been able to produce quite a large number of these emergency kits and everything to deal with the pandemic. Ultimately, now is being produced in surplus, and we are actually exporting it out.
Thank you. We have a question from Kashi Vishwanathan, who says, with the opening of international travel, isn't there an increase in the risk of COVID-19 infection being imported? What is the recommendation of the task force after the opening up of the international travel?
Yes, so our recommendation is very clear. Keep up with your normal protective practices. So keep on wearing a mask when you are outside your house, or you are in closed and confined spaces, or you have some visitors in the house who are from outside. Keep social distancing as much as possible. We understand we are in Mumbai, India. The population density is huge and social distancing may not be possible or at all times. And as per the government guidelines, the Government of India guidelines and the ICMR guidelines, please adhere to the vaccination timelines. So whatever the government advises, please go ahead and take the vaccines as per the government guidelines. That's the best you can do. World is going to open up. You will have people coming out from abroad and perhaps bring in viruses, or we may go out and give back virus to some other country. Vice versa is possible. We should live now with the virus. We should learn to live with the virus. There is no point in just saying that we will not be stepping out of our house. The normal business has to start. The normal schooling has to start. Education has to start. The economy has to flow in. And that's the sentiment across the globe. We've now been clearly tutored very, very well by so many experts across the globe. What can be the preventive strategies? Again, I repeat, it's in our best interest to shoulder the responsibilities ourselves and not have anybody tell us that this is what we should do. So we need to be a bit more responsible and just act responsibly.
Absolutely. And doctors like yourself, who have been on the front line of this entire two odd years of warfare, would be taking this, handling this issue on a day-to-day basis, and you have been doing it fairly well.
Look, I think doctors across the globe did what we were supposed to do. Many of us stood up to the occasion. Some of them who were themselves sick or having these comorbidities were initially skeptical of joining into as a frontline workers, and you would have probably found that in the first part of the pandemic. But eventually, with the Government of India prioritizing healthcare workers for vaccine and everything, now you see that the entire medical workforce is in action, and there is that fear of COVID-19. At least in the medical circles, is something which is now an acceptable fear. It's just like we were, when influenza came in, when HIV came in, people with HIV are being operated every day now. People with hepatitis B are operated every day now. So I think those are some of the risks which we understand. We take measured, we take measures to actually counteract or make ourselves safe, and we are prepared to go and work. So I think it's now for the common man to make sure that they take measures to protect themselves. Again, I'm repeating the same thing. Maybe I'm a bit repetitive, but that's where it boils down to currently.
Right. Doctor, we have one more question. So says, can you ask Doctor one more question? What about the flu vaccine? Can we also take the flu vaccine now? I've taken a booster 2 months back. Can I take a flu vaccination now because just to fortify myself until the next booster, or should I just wait for the flu vaccine in the winter as doctor has advised?
So you can't go wrong with the flu vaccine. The best time to take the flu vaccine in India is in the month of September. You need to take it just before the onset of winter. So you need to take it around 2 to 3 weeks before the winter onset starts. So winter onset starts around October or so, Diwali time, just around that time. So usually I request my patients to take it in the second week of September. There is a reason for that. The reason is that every year there is a new strain corrected vaccine which comes into the market in the month of August, September. So when you take the vaccine in the month of September, you have the latest strain covered up in that vaccine. So the vaccine companies tweak the vaccine for the current available strain, the mutated strain of influenza vaccine. However, for this gentleman, the person who has asked this question, if unfortunately they have a disease which carries a significant amount of risk for them to catch up influenza, even in this season now, there is no harm in taking the influenza vaccine 2 to 3 weeks, between the 2 to 3 weeks gap of the additional dose of COVID-19 which they have taken. But that risk they should discuss with their doctor and then take. Otherwise, for everybody who is above 60, everybody who is a diabetic, irrespective of their age, they should take a flu vaccine in the month of September.
And you can take the flu vaccine only once a year, right? You can't take it more than
flu vaccine is once a year, correct? Once in 12 months.
Once in 12 months.
There is a pneumonia vaccine or a pneumococcal vaccine, which is to be taken once in 5 years for, again, high-risk population. So elderlies can take a pneumonia vaccine once in 5 years. People who are diabetic, poorly controlled, who are on immunosuppressive therapy should consult their doctors and take the pneumonia vaccine once in 5 years as well.
Doctor, since you mentioned about consulting the doctor, this is a question. There's something that I was speaking with doctor just before the session started. One of the extinct species, I would say, in a city like Mumbai, especially, is the general physician, the GP, and the family doctor, as we would call, has kind of vanished for whatever reason. Whether it's doctors not getting into being family doctors, or whether real estate has become prohibitively expensive. Now, for a person who doesn't have a general physician, what does she or he do?
Yeah, so good question again. There are several factors for which the general practitioners are not coming up, newer ones are not coming up. I think you can visit a government-approved vaccination center, which is present in most of the government or the municipal hospitals, or you can visit an MD physician, and they will be able to guide you whether. See, the reason I'm saying is why you should consult a doctor if you're immunocompromised, because they have to give you that window, the safe window in which you can take the vaccine. If you're on the immunosuppressive therapy, the doctor might advise you a few things, that you take it in between this and this week so that your therapy doesn't get affected. And at the same time, you don't want to take a vaccine when you are really, truly badly immunosuppressed. So I think that's why the doctor consult is important for those who are on immunosuppressive therapy. For those who are diabetics, they are naturally immunosuppressed because of the disease. They should take it. Those who are above 60, they are at a high risk. They should take it. They don't need to go and see a doctor. They can just go to a vaccination center and see the doctor who is in charge of the vaccination center, and they should be able to give them the vaccine.
But my question to you, and this is not a question that has been asked, but I'm just asking, for instance, can one go to a hospital such as, say, yours, and refer to somebody as one would go to a general physician?
Yes, you can come to us and say that we would like to see a medical physician, and you would have at least one who is in the outpatient department most times during the day. So between 9 and say 8 in the evening, you will always have one physician who has got his OPD running there, and you will be able to consult them. Not only that, hospitals like Fortis, have a vaccination department. You can come and visit our vaccination department, and there are doctors who specifically look after the vaccination programs, and they would give you the required list of vaccines which you should recommend it, or you should be taking it. Remember, a pediatric vaccination program is a well-oiled program which is going on it's a national program going on for several decades now. And adult vaccination programs are also quite extensive. We are just talking about vaccination in terms of COVID-19. It's influenza vaccine, it's pneumonia vaccine, it's hepatitis B vaccine, it's booster dose of diphtheria. There are so many vaccines which people take up when they go abroad to countries which require those vaccinations to be taken up. Of course, some of them like yellow fever have to be taken in a government approved center only. So vaccination programs are very well understood and taken seriously by many hospitals, and you could find them in government as well as public hospitals as well as private hospitals, where you would get the answer for your question.
Thank you. Doctor, there's Vijendra Kumar who's asking what should be the gap between the booster and having suffered from COVID. You had mentioned 3 months?
3 months. 3 months.
We have a question from Katie Dadaji, and I think you've answered this again, but since she's a regular person here, still, how long should one wear a mask when one goes out?
Look, I think nobody has the right answer for that. My scientific reply to that is what I gave before, that unless the disease burden across the globe goes down considerably, where you have just like what India has right now, if all the countries in the globe had the numbers what we have currently, I would say the disease burden is low. But that's not the case. There are countries like US, UK, China, Hong Kong, where the disease burden is huge right now. So you need to keep on wearing a mask.
Doctor, there are 2 questions on Ayurvedic systems. One is, both are from anonymous attendees. One is saying some Ayurvedic systems claim that BP can be cured. Similarly, they claim curing of high sugar levels. How far are these true? The second question that we have is, for the last 2 years, I've been having a lot of kadhas. I've been giving gaps between the 2 kadhas. Should I continue given the fact that the incidence level is low?
Okay, so the first question, I have no idea. I have no idea how the Ayurvedic science works. I'm completely an allopathic doctor. If there are claims made by them and if there are publications to that effect in scientific journals, refer to them and have your best trust and gut feeling of whether you want to follow that or not. As far as kadhas is concerned, I think we overdid everything. So I'm not referring to Ayurvedic science at all. We overdid the steam inhalations, we overdid the kadha, we overdid whatever we thought was preventive, we overdid it. I think there is no role of kadhas. We were never taking kadhas before. Kadhas don't have any preventive action which can be continued for years together. Everything in excess will have its own good and bad effects. So I think if the disease burden is low and if you feel that you can come off the kadhas, it would probably be in the best interest. Apart from that, again, I have no idea of the contents of the kadhas which are being used by people. I would, as the allopathic doctor, I would much rather believe on the vaccines and the strength of the vaccines, which are scientifically published and they are in public domain, which I can read and I can choose for myself voluntarily, because vaccination is voluntary, whether to take it or not. Similarly, kadha, if there is data available, by all means, read that data in the public domain, whatever it is, and make your best judgment.
Doctor, I'm sure in the last 2 years, especially, while you always face such inquiries, but over the last 2 years, I'm sure these kadha-related inquiries and alternative medicine inquiries must have increased. What is your general advice? Is it what you just said, or is there?
Yeah, I don't advise kadhas because I'm not a specialist in kadha, and I have no idea what it means. So this is what I advise you. The person has to make their own judgment. But I have seen kadha and steam inhalation related complications. I've seen people come in with burns. I have seen people with oral mucosal burns. I have seen people come in with severe gastritis. I have seen people come in with severe kidney problems and liver problems because too much of kadha was taken and it contained medicines and drugs which were harmful to the kidney, heavy metals at times, like lead, arsenic, gold, which were a form of that. So I've seen these complications, but those complications are not hundreds and thousands. I've seen one-off patients for each of them. So whether it was CADA related or something else or just a natural occurrence, it is difficult for me to sort of pinpoint on that.
Doctor, I have two more questions that have come in. One is you mentioned about the second booster coming in. What about a person who is not 60 and who has comorbidities? Can the booster be given to that person?
I think the booster will come out, the additional dose will come out for that population, that group of population right now who are not 60 but have comorbidities. Remember when the vaccination started, after the healthcare worker, there was a, people above 60 or people with comorbidities, and you had to have a certificate from the doctor with a list of comorbidities which were allowed to be vaccinated. I think something similar would come.
Doctor, I want to ask you, we spoke about CARAs and we spoke about a whole lot of these things that people take to basically, and you see a host of ads also that are there, which are immunity boosters, etc. What does Dr. Rahul Pandit and family do to build the immunity?
Okay, so let me first say there is nothing called as immunity booster. You either have a low immunity or you have an adequate immunity. So to have an adequate immunity, I think you need to get your basics right, which unfortunately Dr. Rahul Pandit is not able to do all the time. And that is have 8 hours of sleep, good meals, nutritious meals, whatever you're vegetarian, not non-vegetarian, whatever you eat it in the right way, right quantity, and essentially have some exercise every day. These are the 3 things which will first of all make your health really, really improve in terms of your immune response. Make sure that you are having adequate sunlight exposure. If not, then please take vitamin D and please take calcium along with that. Vitamin C supplements and zinc supplements when you are ill can help you improve your immune response to a disease. But again, the quantity or the dose is normal, not humongous doses of vitamin C or ascorbic acids being given to people. And the most important thing here is to essentially have the preventive strategies which we talked about during the show continued. I think those are the ones which are going to help us. I don't take any other vitamin or anything on my day-to-day basis, and in the last 2 years I have seen more than 10,000 ICU patients physically, and I've had COVID once, right in the beginning of the pandemic.
And how did you handle that?
Oh, I was pretty sick. I was on oxygen for a couple of days. So it was right in the month of May 2020. And we were learning at that time, we were still learning how to have protection from all angles. So I don't think I caught it in the ICU. I must have caught it outside when the guard was low. And since then, we've become really, really very, very vigilant about it. For example, we have lunches and dinners in our own room in the hospital. I don't go to the cafeteria that often and have common coffee or tea or lunch for example. I carry home food now for last 2 years compulsorily. So in between, of course, it was sort of very difficult to get food from outside anyway. So it was home food. I make sure that I never remove my mask in front of anybody ever. And that has been the most protective thing.
Thank you very much, Doctor, for your time here. Dr. Pandit, thank you for being here. Thank you for being here on a Gudi Padwa day and for taking time. But I think you have answered a host of questions, a host of varied questions, which a lot of people, and including myself, have had this in mind. But suddenly, now the world has opened up and you are asking these questions, but what if, etc., etc. So thank you very much for taking time, and thank you for responding to our questions. We will be back once again next week, that is on the 9th of April, for our next session of Health Live at Seniors Today at 5 p.m. as always. Thank you very much, Dr. Pandit, and thank you.
Thank you. Thank you.
subscribe now and press the bell icon. Never miss an update.